Did you know that some of the common signs of aging, such as shortness of breath and increasing fatigue, may be symptoms of severe aortic heart valve disease? Well, here with more is Dr. Marc Gerdisch, Chief of Cardiovascular Surgery for Franciscan St. Francis Heart Center in Indianapolis. Welcome, Dr. Gerdisch. All right, now this is very serious. What are some of the signs that people should be looking for?
Good morning, Angela. Thank you. When a person has a problem with the aortic heart valve, it means typically that the valve doesn't open and close properly, and that interferes with blood flow through the heart and out to the body. With respect to what to look for, the first sign might actually just be a murmur. The first sign of any valve disease is typically a murmur, which is the sound that a doctor or nurse might hear when listening to the heart with a stethoscope. With respect to symptoms, though, as you mentioned, people frequently experience shortness of breath or worsening fatigue that progresses slowly over time. And we have to be aware of that, because as soon as a patient becomes symptomatic, there's actually an impact on their lifespan. And in fact, about 50% of the people, only about 50% of the people will still be alive after the onset of symptoms from aortic valve disease.
Wow. So it's easy to think that, all right, I'm getting older, this is natural. Not necessarily the case. What are some of the things you need to, I guess, ask your doctor?
So, Angela, that's such an important point, that people often will have these symptoms, shortness of breath, fatigue, even some other symptoms like dizziness, and they'll attribute it to being older or maybe putting on a few pounds, and they really need to describe those symptoms to their physician, because the physician may hone in on those issues, especially with a physical exam. With respect to conversation about aortic valve disease itself, once you realize that the valve needs to be replaced, you need to talk to your physician about the options, the types of valves that might be implanted surgically in order to treat the valve. It generally comes down to two categories, mechanical and tissue valves, and they differentiate fundamentally by durability and whether or not they need blood thinner. Tissue valves typically don't require blood thinner, but they have a limited lifespan. So it's not unusual for me to be reoperating patients who had a tissue valve implanted only several years before. Mechanical valves will last the entire life of the patient, but they do require a blood thinner, and that's part of the conversation with deciding what to have implanted.
Along with, now there was recently a report, the FDA's position on blood thinning medications and a particular mechanical valve. Could you tell us a little bit more about that?
So the FDA recently ruled that patients with the Onyx mechanical aortic valve can be managed at a much lower dose of blood thinner. This is important on multiple levels, but as a part of a study that we did for the Onyx valve, we looked at whether the valve could be managed at a lower dose of blood thinner, and in fact we found that the valve was safe to run at a lower dose of blood thinner, and there was a 65% reduction in bleeding complications. So the thing that people are most concerned about on blood thinners, of course, is bleeding, and with the Onyx valve, the FDA has cleared it for management at a much lower dose of the blood thinner.
Now that sounds like it's good news for patients, is it?
Yes, it's great news for patients. In fact, it really changes the clinical landscape of heart valve treatment. In the past, patients may have avoided having a mechanical valve implanted when they would benefit from it, just because they were concerned about the blood thinner. But now, with the Onyx valve, they can have the Onyx valve implanted, they can take a lower dose of the medication, and also lower their long-term risk of complications related to the medication. It really should impact their lifestyle in a positive way.
Yeah, that's good news. Thank you so much. It's so important, and it's good information, very important. Could you tell us how we can get more information, where we can go? Is there a website or? Well,
patients should always start with their doctors and have a conversation about their symptoms, about the valve choices, but also they can go online. Onyxlti.com, onxlti.com is the site for the valve itself, and they can learn more about the valve there.
That's great. Dr. Marc Gerdisch, thank you so much for joining us here on Let's Talk Live. Any more before we let you go?
Thank you for having me.
You're all set?
Thank you for having me.
You're very welcome. Thank you so much. Have a good day, and we'll be back with more Let's Talk Live right after this.